The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. Good almost afternoon, folks. Thanks for joining us today. We will get started right at noon with our webinar featuring the research team from Invisible People. So just hang tight with us for about the next 10 minutes.
Good afternoon, everyone. This is Allison from MICA. Again, we will start at noon, but while we wait, if you want to let us know where you are at right now, so we can see how much of the state we're actually reaching today. And then if you want to let us know what you're most excited about this summer, since, you know, it's the middle of June already, if anyone can believe it. So I'd love to hear from you. And we'll start at noon. Looks like we have folks from Warren, Michigan already, and Ann Arbor. So representing, you know, the Southeast Michigan portion. Let's hear where everyone else is from. We have someone coming from Traverse City, so much farther than Southeast Michigan, and two from Flint. So welcome, everyone. So I will share, I am physically in Plymouth, Michigan today, and my agency MICA is in Lansing. And what I am excited most about this summer is seeing my son, who's almost 2, be excited about being outside all of the time. So that is going to be really exciting for me.
Allison, I love this question, so I'll go ahead and tell everyone mine too. Hi, everyone. This is Laurel Birchfield with MICA as well. I am based in Lansing, our beautiful capital city, and I am very excited this summer to just get some lake time. We have one really good lake here in Lansing with Lake Lansing, and it's been a lot of fun to see little ones swimming in the lake. So I'm very excited to do that again this summer.
Oh,
All right, we have just a couple minutes left to go. For those who are joining us, thank you so much for calling in for our webinar featuring the research team from Invisible People. We're going to get started here in just a couple minutes at noon, but while you're waiting, go ahead and use the questions box to let us know what part of the state, or if you're outside of Michigan, what part of the country you're calling in from and what you're most excited about for this summer. We'll get started in just a few minutes.
So far, we have been told we have the most participants from Flint at 2. So I'm wondering if there's anyone else from Traverse City or Warren or Plymouth, probably not that small, or Lansing with us. We have Oakland County, and they are excited to have an actual vacation. I hear that. So we have another Warren, someone else from Lansing, Troy, Jackson, Adrian, Michigan, and this person is most excited about going camping. So some more outside excitement that people are looking forward to. We have not had a city top out at 3 yet to have, somewhere where we have the most representation. There's lots of people who are 2 in one city. So if you want to share with us where you're at today and what you're excited about for the summer, while we wait the last 2 minutes before we're going to start the actual presentation. We have Ottawa County, Jenison, Michigan, I think is maybe how you'd say it. Looking most excited for camping and enjoying your pool. Bring on the heat. Yes. It'll be nice to be in a pool again with other people. So you have 1 more minute if you want to share with us where you're from or what you're excited about this summer. If not, the presentation is going to start very shortly. We have someone from NEMSCA, Northeast Michigan Community Service Agency. I am specifically in, no idea how to say that, Iosco County. Looking forward to a lot of beach time. So yes, everyone is excited to be outside. And I am learning a lot more of the states and counties since having this job when I've worked the rest of my career in Southeast Michigan only. Sedum in Detroit, looking forward to taking advantage of the patio season, the beach, and road trips. Yes. We have someone looking forward to going downstate to see their family because they are in Sault Ste. Marie. And someone else from the Shelter Association of Washtenaw County looking forward to time with family. So thank you everyone that participated in our little activity. I'm going to pass it off to Laurel now because it is noon, so we can start the actual event.
Thanks, Allison, and good afternoon, everyone. I am going to ask our panelists to come on camera, and I'm going to unmute folks. But thank you so much, everyone. You're here for our webinar on the new research from Invisible People, and we're very excited to have you and to have a fantastic presentation for today. Before we begin, just a little bit of housekeeping. First, I want to acknowledge that GoToWebinar is our platform, and if it's something that you haven't used before, it's fairly user-friendly. You should have the ability to access the question box. If you've been participating in the little bit that we did at the beginning with Allison, that's where you were putting in your city and what you're looking forward to this summer. That's where you'll be able to send us questions throughout the presentation. We will hold those for the end, but we encourage you to send those questions in at any time, and we'll get to all of the ones that we can manage before we run out of time today. In addition to that, everybody is muted on this call, so that's going to be the best way for you to interact with our panelists today. We also have a handout. On that same toolbar, you should see a drop down for handouts, and you can actually download the PDF version of the presentation that the team is going to be going over today. If you are having any trouble with audio or video during this presentation, unfortunately, sometimes that does happen, and it's usually just an error with the way that you're connected. There's nothing that we can do on this end. We just encourage you to log off and log back in. If you use the audio drop-down option on your dashboard, you can just call in if you're having audio issues with your computer as well. I think that's all that I have for housekeeping. We are recording this, and we will be putting this on our YouTube channel and sharing it with everyone who registered. We have a fantastic turnout today, but we know we also had a lot of folks register who have indicated that they're no longer able to attend. So we'll be sending this out and encouraging you all to share it with your networks after the event as well. Finally, I want to acknowledge that we have fantastic co-sponsors for this event. In addition to my organization, the Coalition Against Homelessness, we also have CEDAM, the Michigan Community Action Agency, and the Michigan League for Public Policy, who have all come together to sponsor and share this webinar with their network. So we have fantastic state folks who are here to learn more about how we can communicate around issues related to homelessness. And so thank you to our co-sponsors. Thank you to our panelists and our presenters today. I'm very excited to learn from you about this new research. So I am going to pass over controls and have our first presenter, Mark Horvath of Invisible People, go ahead and take over. So let me do that very quickly. And Mark, you should now be able to share your screen and say hello.
Hello, hello. How is everybody? I am so excited to be with you over the internet, although I do miss going in person because I was able to spend time up in Traverse City with Ryan, and there was pie. There was pie always in presenting in real life. So hopefully we'll get back to that soon. And hopefully these slides will advance. My name is Mark. I'm the founder of Invisible People. There's the handout that you can download, but you can get access to the full report by going to invisiblepeople.tv/2020 research. And each presenter as we go forward is going to introduce themselves. I'm just honored to be the first one in a line of really great people this morning. We're going to do a quick introduction, how stakeholders can use this, overview of key findings, how the public views homelessness, messages and audiences, recommendations, and a Q&A. We're going to go a little bit fast because the Q&A is really great, and I believe there's still room in the workshop that's after this. So those of you that want to have more of an interactive experience, I recommend the workshop. I have been doing this work for 12 years, and the only thing that I was ever able to find was this research or this statement from Susan Fisk, and basically basically view particularly homeless people as having no redeeming qualities. No redeeming qualities. Oh my gosh. That statement is just so powerful. So for years, I've been working to change harmful narratives. And there was no research on this, both messaging and the research of what people believe. So I went and made it happen. And that's what we're going to discuss today. I think to lay the foundation, we really have to dissect or show what the public receives about homelessness. So I'm going to do a real quick little demonstration or examples of messaging. At the foundation of invisible people's work is our inability to relate to homelessness is our biggest obstacle to solving it. What we see, what people see with their own eyes, is the dominant messaging people receive. The nonprofits show success. We have to, none of this is bad. I'm just showing you the different messages people receive. I took this photo. I helped house this woman. We have to share successes, but people also get the success messaging at the same time they're walking by homeless people on the streets. Rescue missions, faith-based organizations share, especially around the holidays, you can end homelessness for $2 a meal. And that's not necessarily their fault. They're fundraising and people respond to feeding, and they're trying to raise money for their programs. So I'm not saying this is a bad thing, but hundreds of thousands of direct mail pieces and Facebook ads go out probably every month saying the solution to homelessness is a $2 meal. There's growing social media. There are accounts in probably every city now. And I could go a whole hour on this. In fact, our last live stream I did. But what's happening in Venice right now, there's some negative social media propaganda. There's people that just show negative on social media, and they are influencing local and national news media, which has now brought in politicians and the sheriff, and it's all started by negative social media propaganda. So this is, again, messages people see, and they're horrible. These, I don't even really want to call them NIMBY'S, but they use good storytelling tactics. Here's video. Both of these women, I would never tell their story on the internet in a way that identified them. Both have severe mental illness. I think it's shaming, but they're telling these stories to inspire more police action, and they're very effective of it. And we need to pay attention to good storytelling tactics. There's organization, Functional Zero is brilliant. Some organizations, I haven't updated this, are saying we ended 82 cities have ended veterans homelessness. Others are saying 14. Well, which is it? I get it. Different protocol. And I do think Functional Zero is a brilliant model. But when the mayor of Atlanta stands on a podium and says we ended veterans homelessness, and people drive and see a homeless person with a sign that says veteran hungry needs food, what do you think they believe? It creates distrust. Government likes to show data. And then you have influencers like Dr. Drew, who comes out and says the housing crisis is a hoax. And he has millions and millions of loyal followers. And we'll talk about influencer marketing a little more in the workshop. But look at all these messages, and there's a direct correlation, a direct line between how the public views homelessness and choices in policy change. And we're seeing that right now as criminalization, the push for police action, is getting louder. And I would like to introduce Barb. And I'm going to change over the control to Mike. Hi, Barb. Can't hear you.
Good afternoon. I'm Barbara Poppe. I'm a consultant based in Ohio, but I work across the country. I got started working nationally as I left the U.S. Interagency Council on Homelessness, which I headed during the first part of President Obama's tenure. It was during that time period that we issued Opening Doors, the first federal strategic plan to prevent and end homelessness. My work before that was in Columbus, Ohio, where I led the public-private partnership to address homelessness. And I have to say that the work that Mark has been leading under Invisible People has been really helpful to the work that I'm seeing across the country, and in particular, as we work with elected officials and other civic leaders. This groundbreaking work that I was happy to play a small part in really has given us a set of tools that have never been available before. We are all really passionate about homelessness, and I know we really want to come through as authentic. We don't want to be boring or preachy, but sometimes when we explain things, we get really on a roll. And by the end of it, we've totally lost our viewers because we've lapsed into acronyms and great boringness. What we really want to do is educate, inform, and because attention spans are so short, we really need to be thoughtful. We need to be concise, and we need to have some impact. And especially in such a polarized society as we find ourselves today, we really want to create some common ground. And so what I'm finding exciting about this research is, first of all, we can talk to people better understanding who the segments of the audience are. Everyone doesn't think the same about homelessness, and we need to have good messages that work with each of those audiences. And in particular, we want to target the specific messages that fit the best to help them really understand what works. And I always think about messaging as this is a way for us to win friends and allies. And if we talk in language that is accessible and helps people understand while also building their commitment to it, we're going to do much better at our jobs as advocates. So I really want to thank Mark for leading this work, and Mike in particular for all the great skills that he's brought to this. So thank you, and I look forward to y'all's questions in the Q&A box. And I am going to pass it over to Mike.
Sorry, now I'm unmuted. Great. Hi, everybody. My name is Mike Dickerson. I was kind of the lead researcher on this project. My background is in market research, and also here in LA, I'm a co-founder of K-Town for All, which is a local homelessness advocacy organization. So a little bit of that on the ground experience as well. So this research is really rooted in the idea that public views drive policy, right? Elected officials are responsive to the views of the public, and what the public thinks is often really driving this conversation. But what we discovered in the research is that there's a real gap between public views and more expert views on homelessness in terms of causes, in terms of solutions, and we'll get a little deeper into that in a second. So kind of the purposes of this, we wanted to uncover public attitudes, to identify what's driving negative sentiment about homelessness solutions and homeless people. We wanted to test the effectiveness of some different messages that one might employ when talking about homelessness. And we really wanted to deepen our understanding of different audiences. So before we get to the meat of it, I just want to talk a little bit about the methodology here. So we surveyed a little over 2,500 people. We chose a selection of cities to try and get representativeness kind of broadly across the country, as well as to draw some contrast between high and low unsheltered communities. One of our hypotheses going into this was that the visibility of homelessness would potentially drive negative sentiment. We see a little bit of that, and we'll go into more detail on that in a second. So the people that we interviewed were not employed in marketing or social services, and we balanced to census by age and gender. So our goal is just to get a broadly representative sample of people and their views on kind of urban homelessness in particular. So broadly, people think the problem of homelessness is getting worse. 73% believe homelessness increased in their community this year. Most of the rest see no change. There are very few people who think homelessness is actually decreasing. And in particular, the pandemic has intensified those concerns. Not only are people concerned about the homelessness they already see, but about the potential for more people to get evicted, to become homeless. In terms of where people learn about homelessness, it really starts from two places. One is just what they see on the streets. That's often the time when people are most likely to think about homelessness, is when they see a tent, when they see someone sleeping there. But it's also local news, especially local television news is a huge driver of people's opinions and perceptions on homelessness, which presents both an opportunity and a challenge for us as messengers. And so when the public talks about homelessness, there are kind of a few different issues at play, all of which sort of compete for that priority, right? One is housing and affordability. People are concerned about wages not keeping up with housing costs. People are aware that often people are struggling just to make rent. But along with that come conversations about drugs and mental illness. And I'm sure we've all experienced that when talking to people about homelessness. Those are often top of mind because those are often the most visible cases. And so that's kind of the first gap we see between experts and the public, right? Experts tend to focus on affordable housing, on supportive housing as sort of the causes and solution to homelessness, whereas the public conversation is much more dominated by issues like drugs and alcohol. Oops. So we also looked at people's policy attitudes. And most members of the public offer a kind of ambivalent set of views, right? It's a mixture of sympathy and judgment. As we discussed, a lot of people have negative views about homeless people. And at the same time, people are sympathetic, right? They want people to have a home. They don't want people to be on the streets. And so you find a real tangle where there's not always a clear, people who are trying to help and people who aren't, right? It's a much bigger mix even within individuals. Broadly on policy, there is big support for positive interventions. It seems that sympathy wins out. Things like shelter, permanent supportive housing, tenant protections, and rental assistance. All of these kind of positive measures aimed at keeping people housed are generally very popular. However, some policies are more controversial. When we talk about policing and criminalization efforts, there is certainly some support for this, but there's also a lot more opposition than you see to things like housing and shelter. And we looked a little bit at analyzing what drives negative sentiment, and we found a few particular factors. NIMBY sentiment, that idea that, solutions don't belong in my backyard, as well as political leaning, and in particular, how people view the causes of homelessness has a huge effect on what they see as the solutions and how they feel about homeless people. We also tested a number of messages. Our goal was to get, kind of a broad set of different messages that advocates might use about homelessness to try and understand what was going to be most effective in driving public opinion, in improving people's perceptions of homelessness, and improving support for solutions. And broadly, there were kind of two sets of messages that rose to the top. The first is this idea of shared struggle, that homelessness can happen to anyone, and that people deserve help, not blame or scorn. The other set of messages that were quite well performing were focused on health and recovery. So dealing with the health impacts as well as things like mental health and addiction as causes of homelessness. The goal of this really is to build empathy, right? The messages that were successful were ones that created a sense of commonality between the public, the housed public, and their unhoused neighbors. And really, we think the most effective messages are able to connect empathy back to policy. Right, there's definitely a desire for those sort of personal or inspiring stories, for that real human connection, but that ultimately what we need to do is sort of connect that empathy back to bigger policy issues. Finally, we kind of broke down different audiences, right? So when we're talking to people about homelessness, we're not talking to just the public at large, right? We're talking to particular audiences. And using the attitudinal data we had, we were able to kind of segment our audiences into 4 rough groups based on their general attitudes about homelessness. We have involved advocates who are kind of the most involved, who are willing to kind of get in and do the work, hesitant helpers who are sympathetic but a little bit more reserved about, walking up to a tent and engaging someone, active ignorers who are exactly what they sound like. They are people who just want to stick their fingers in their ears and ignore this problem, and then our stubborn skeptics who are often that very loud opposition when you're trying to get a project in place or whatever. when we think about multiple audiences, the reason for that is that we need to differentiate our message, right? When we're talking to a group of dedicated advocates, that's very different than talking to a group of, sympathetic church attendees or a group of politicians or, the Chamber of Commerce, right? When we speak to these different audiences, it's important to focus on the context that you're in and the goals of that messaging. What are you trying to accomplish with that audience? And so we'll come back to some of these more specific audience recommendations at the end, but for now, let's get into the meat of the research. So you can see here, the public sees homelessness as growing. 40% saw it increase a lot in their community, 33% said it increased a little. Just 5% down here said it decreased a little or a lot. And this was pretty true across geographies, right? People see this as a problem that's growing worse. And this presents a problem for us, right? Because if we want to talk about our successes, we're running up against this reality of what people are seeing on the streets, which is this problem is getting worse. And they're worried that it's just going to continue getting worse because of the pandemic. So for most people, homelessness is not top of mind most of the time, right? For people who aren't working in the field or spending a lot of volunteer hours, they think about homelessness pretty rarely, right? So, sort of the most common places that are influencing people, what they see on the streets and local TV news, followed kind of just down there from local newspapers and word of mouth, right? So local media and conversations and people's own eyes, that's really what's driving people's perceptions of homelessness. Now, again, this presents another challenge to us as messengers because we're trying to break into that space. And so we have to keep in mind that these are sort of the starting perceptions that people are coming in with. One thing useful here, keeping track of what local news stories are popping in your area, because that's really going to have an outsized influence. Even a story about one person, if that's one of the only times someone thought about homelessness in the last few months, is going to have a really outsized impact. The public also has very complicated views on the causes of homelessness. So as you can see, there's this cluster at the top here: drug and alcohol addiction, mental health issues, job loss, and unemployment. Beyond that, there are a number of other economic factors that people see as driving: personal finance, housing costs, eviction, and foreclosure. And so you really see this mixture of a focus on issues of mental health and addiction with an understanding that there's, this sort of economic financial side of homelessness as well, that there's housing affordability issues, that there's wage issues. And so 60% view either addiction or mental illness as the main cause of homelessness. This is obviously another place where expertise and the public kind of run into a clash. But it also means that when we're talking about homelessness and when we're trying to push the kinds of solutions that we want, we really need to take this into account, right? These are often the first concerns of people. These are drivers of the perception that people are dangerous. And so if we don't engage with those attitudes, then it's going to be very difficult to move people towards that more empathetic position. We'll talk a little bit more about how to do that and especially expand a little bit on that in the training later today. Try and think of some sort of practical strategies for dealing with this problem. So we asked people to respond to a number of attitudinal statements. We presented these as bipolar statements. So for example, with the first one, either do you agree more with I feel comfortable around homeless people or homeless people scare me? So you can see that that's pretty much split down the middle, right? On the one hand, there are people who feel very comfortable going up to an encampment, going up to talk to someone. And then there are people who have more reservations, who are worried, whose perception is that there's drugs and alcohol and crime happening here. And so they feel unsafe. Similarly, there's a big divide kind of right down the middle about how different neighborhoods should be involved, right? And this is kind of what we use as our proxy for that NIMBY sentiment, right? On the one hand, people who think some neighborhoods are more appropriate than others tend to be a little bit more protective of their own neighborhoods. People who want all neighborhoods to be involved tend to be a little bit more comfortable with, projects in their own backyard. There's generally a little bit more worry about homeless people as victims of crime than as the cause of crime, although as we see, there's still that perception of danger. Most people are feeling guilty, but these last two, I think, are really interesting to us. You see a lot of people agreeing more that homeless people have the right to choose what to keep and that they should be allowed to live in their cars. These are often particular targets for criminalization policies, that are focused on confiscating property or focused on preventing people from sitting in their cars in particular locations. And often these are perceived as very popular moves by politicians. And what we found is actually that these were far more controversial than other policy choices and other framings of the problem. And so it really sort of cuts against that idea that because mental health and addiction are seen as causes, that necessarily implies the need for a crackdown or the idea of danger. So then we focused a little bit more on specific kinds of policies or programs that one might implement to try and address homelessness in their own community. You can see here, it's a pretty broad range, and for the most part, overwhelming support. When we get into this end with rental assistance and rent control, there's a little bit more reservation. But overall, there's incredibly broad support for interventions that try to work with people who are already homeless, as well as for interventions that try and keep people housed. You've got about 3/4 supporting the expansion of permanent housing, and 56% supporting expanding mental health services. And so overall, just a lot of support for those positions. So we tried to understand, using some statistical analysis, what different factors were driving negative sentiment among individuals. And we identified kind of 5 things that we see as contributing to those negative sentiments or making people more likely to hold those negative sentiments. In terms of political leaning, folks who are more left, a little bit more sympathetic to government interventions, a little bit more sympathetic to homeless people themselves. People who lean more right, a little bit more individualist in their framing, and a little bit more opposed to those kinds of government interventions. In terms of gender, we saw men a little bit more focused on enforcement policies and a little bit less supportive of those more sympathetic policies in contrast with women. In terms of causes of homelessness, this is one of the biggest drivers. As we discussed earlier, there's a split between people who focus on drugs and alcohol versus those who focus on more financial issues. When folks focus on drugs and alcohol, they tend to have much less sympathetic views. In terms of unsheltered population, that also contributes. In areas where there's more unsheltered people, people tend to have more negative views. And then finally, this kind of not in my backyard sentiment. People who think some neighborhoods are better than others for citing these kinds of projects tend to hold broadly less sympathetic views and more opposition to supportive policies. So we can see here kind of this big split in terms of how political views are influencing people's attitudes. There's a huge gap here between left and right on government should do more to help homeless people. Among folks who are left or left-leaning in their political identification, there's almost universal support for additional government assistance to help homeless people. There's also a perception that this problem can be solved. There's more sympathy towards that idea that homeless people should be able to hold on to their belongings and that, potentially police or sanitation coming in can be harmful. Right-leaning folks are less likely to see the government as responsible for homelessness. They're more worried about crime, and they tend to hold more of these kind of NIMBY views. And so you see a pretty big divide there. And obviously, because of the way our politics is structured, this is often very primary and very on the mind of electeds. And so it's important to keep these things in mind and to understand the constituency of who you're speaking to. We also saw that there was a bit of a gender gap. Things like involuntary commitment, obligation to shelter, increased policing, and harsher criminal laws were all more popular, more supported by men than by women. In contrast, there's a sort of smaller gap on these more sympathetic services. And so there's a stronger belief among women that homelessness can be solved. However, there's also more of this kind of guilt and powerlessness that comes from seeing homeless people on the streets. So again, you have that sense of kind of ambivalent attitudes being shared within that same person. So we split people into 2 groups, those who focused on addiction as the primary driver of homelessness versus those who focused on other economic factors. And we find that there are some pretty big differences. Folks focused on addiction are twice as likely to support police sweeps of encampments and almost twice as likely to believe that homeless people are causing crime. They're also more opposed to affordable housing by 33% and more opposed to homeless housing in their neighborhood. And so we see how this focus on addiction and the way that those media stories often frame that can have a really outsized impact on the support for specific solutions. So we also see that unsheltered homelessness is a small driver of this negative sentiment. We had expected this to be a little larger, honestly, but we do see some differences, especially when we get into this kind of more emotional association rather than these kind of specific policies. So in areas with high unsheltered populations, we see a little bit more focus on drug and alcohol addiction and mental health issues, but also a little bit more focus on housing affordability. This is likely because there is some correlation between higher housing prices in those high unsheltered areas, but we do see that that kind of visibility is having an effect. We see this here as well with what people associate with homelessness. Things like danger, crime, drugs, nuisance, mental illness were all more commonly cited by people in high unsheltered areas. And so again, this kind of goes back to that idea that most people are thinking about homelessness primarily when they see a homeless person or a story about homelessness. And as a result, these very visible factors can often be extremely influential. So we also looked at this idea of kind of NIMBY sentiment. So as mentioned, we split people by whether they think all neighborhoods should be involved or just some neighborhoods in terms of providing shelter and housing. Those who said all neighborhoods were far more supportive of supportive housing and somewhat more supportive of shelters, and less supportive of enforcement actions, whether that's increased policing or harsher criminal laws. We also asked specifically about whether people would support a housing project in their neighborhood. Among those who were less NIMBY sentiment, there was an overwhelming yes, whereas there's a lot more divide. Even among those with that expressed NIMBY sentiment, though, we still see almost half supporting a project in their neighborhood. It is important to note that in a survey like this, you're going to see some positive response bias, right? People want to be perceived as sympathetic. They don't want to be perceived as harsh. And so we do suspect that's inflating these numbers a bit. However, the sort of overwhelming support for these policies does indicate that broadly they are popular, and that even some people who hold these kind of NIMBY sentiments are still in support. So kind of getting on to the second portion of this, in addition to asking about people's views, as mentioned before, we tested a bunch of messages and we tried to kind of divide our audience a bit by their attitudes on homelessness. So before we got into testing specific messages, we asked some more general questions about, the stories that people were paying attention to already, right? So, we asked what kinds of stories about homelessness are attracting your attention. Again, we kind of see these four factors rise to the top: sad and sympathetic, informative and realistic. And so this kind of guides some of our messaging recommendations, right? On the one hand, sympathetic and sad, right? People want these personal stories. They want something that they can connect to on that personal level and really understand someone's individual experience. But they also want to be informed and they want to feel like that story is grounded, right? Which means we need to take care to make sure that the stories we're presenting kind of acknowledge the negative while also uplifting the positive. And you can see here from this quote, right? Local news profiling a veteran who was struggling. And the story also showed how difficult it is for people to manage those issues, right? And I think that's kind of the balance that we're often trying to strike, right? And this is why we're a little weary of success messaging, because you need to be able to tell that individual story, but also contextualize. So how is this person who's, maybe eloquently sharing their story, why aren't they able to get off the street? And that means we also need to address those sort of systemic failures, right? The places where we aren't solving the problem, the places where we aren't having success. So as mentioned, we tested 12 different messages. And when we looked at how they performed on the various metrics we tested, so things like whether they would increase your support for projects, things like whether they improve your opinion of homeless people, things like whether the messages are just appealing to you in general or strike you as true. And they kind of fell into three tiers, right? The highest performing messages, homelessness can happen to anyone. Homeless people face poor health outcomes. homeless people need help with recovery and face the same struggles as the rest of us, right? So roughly those divide into two groups, health and recovery messaging, and this kind of what we labeled as commonality messaging. This idea that rather than two extremely distinct groups with different problems, that housed and unhoused people have a lot in common, especially if we're talking about folks on the lower end of the income scale. The same issues often apply. The second set of messages that kind of performed in the middle were these more systemic messages broadly, right? So homelessness is a systemic problem in general, economic problem, an issue of racism and discrimination. And then the fourth framing here is focusing on self-sufficiency. So this is sort of that individualist framing that we need to help people help themselves. So there's clearly some appeal to this, but the messages that focus on commonality, health, and systems did perform better. In terms of the lowest performing messages, negative messages in particular were not very appealing. So a focus on keeping neighborhoods clean, on homeless people as a danger, on wasting taxpayer money, those were less appealing. But also in this group is this idea of system success, that programs aimed at ending homelessness are working. Often we see that folks focus on success messaging, right? They want to show that the program they're running is helping people. And that's important, right? Any of these projects probably are helping someone, but that's happening against the backdrop of a problem that people see is getting worse. And so there's a fine line between saying this program is helping people and this program is solving the problem. And that's where we kind of run into losing people, right? Because they are very skeptical of that for understandable reasons based on what they see. So we tested a number of metrics to try and evaluate these messages. We asked people whether they were believable, right? Some of these messages were more credible than others. And here we saw those kind of four top messages really rising above the others. People do take those systemic messages pretty seriously. But on the other hand, the majority do not see those sort of systemic success narratives as particularly credible. So in addition, we asked about what makes people more supportive of projects and what improves their opinion of homeless people. And again, we find that these same four messages really rose to the top. This idea that homelessness can happen to anyone is really striking in terms of how it performed relative to the other messages, really consistently coming on top across all of the metrics we tested. And so that really, I think, helped us understand this idea of this sort of empathy gap, right? That this feeling that homeless people are not like me, that they are a different population, that they are dangerous, that they are criminals, that those attitudes really, otherize people. They create this alienation between housed and unhoused people. And so a lot of our job is to make sure that people have that human connection and empathy, and that empathy is ultimately leveraged towards those bigger kind of systemic policy level solutions. So here we looked at how that success messaging performed compared to other positive statements, right? So these aren't just the top statements, it's really all of those kind of 7 statements that we see as broadly positive about homelessness. In terms of credibility, only about 2/5 of people see that system messaging is credible, whereas 3/5 see other messages as more credible. Similarly with believability, we have an almost 20-point gap there. And so really, again, to the point Mark made earlier, right, we need to talk about successes. We need to tell success stories, but we need to be very careful in how we frame those stories, right? If we say that the system is succeeding, that's going to lead a lot of people to tune out. It's going to lead them to view that messenger as less credible and ultimately make it harder for them to advocate and to change the minds that they need to change. So using those attitudinal statements we saw earlier, all of those bipolar statements about attitudes on homelessness, we did a little bit of statistical analysis in order to see how those attitudes correlate with each other, right? So we begin by just kind of looking at where those overlapping attitudes are. and then ultimately clustering people into different segments based on sort of attitudes in common. So the goal of these segments is to kind of predict people's attitudes within that particular group. And after working on this analysis for a while, we came up with a segment solution that split our population into 4 distinct groups. We've kind of ranked them here in terms of how supportive they tend to be of sort of positive homelessness policies. So at the top we have our involved advocates. They want to be part of the solution, right? They're people who are seeing the problem and want to step up. They want a call to action. We have our hesitant helpers, right? They want to help, but they don't know how. Compared to our advocates, they are very supportive of projects, but they tend to have more of those kind of ambivalent views about homeless people themselves. They're worried about walking up to an encampment. They don't feel comfortable. They, don't see that kind of self-efficacy in terms of jumping in to try and solve the problem. And as a result, their views are a little bit more complicated than our involved advocates. Our active ignorers just want the problem to go away. These tend to be slightly younger people. They are paying the least attention to homelessness. And, they're really the folks who are largely going to be on the sidelines if we're talking about some kind of, public controversy about citing a project, about whatever. And, as folks who are trying to get those projects made, as folks who are trying to get those policies through, really this is a group that we want to kind of keep out of the discussion in a lot of ways, right? These are folks who don't feel particularly well versed. And then finally, our stubborn skeptics. I only want to help those that deserve it is kind of how we define them here. So these are often the loud oppositional voices when we're talking about a particular policy or project fight. They tend to hold more of that not in my backyard sentiment, and they tend to be a little bit older, a little bit whiter, a little bit wealthier. And so what's interesting, though, is also that they make up a much smaller percent of the population than we often perceive. So only about 17% among the people we surveyed. Again, there is that bit of positive response bias. But when we're talking about that sort of loud, angry group, we're not talking about a broadly representative group of people. What we're talking about is a small group of the loudest voices in the room often. And I think in particular, this is something that's useful to remind our elected officials and other decision makers of. That just because those voices are loud does not mean they represent a majority. So in terms of conceptualizing these different groups, we found that there were kind of 2 useful axes that help us really kind of simplify the differences. So you can see here, those are axes based on kind of sympathy and empowerment. So our stubborn skeptics and our involved advocates, kind of the 2 poles, both of these groups feel empowered. Right, these are the kinds of people you're going to see, already involved in policy fights or kind of getting brought in by their neighbors, by the people they know, in order to, help promote the side that they're on. Obviously, the involved advocates fall on that sympathetic side, the stubborn skeptics on that unsympathetic side. Among those who feel less empowered, right, we also have 2 groups split by that level of sympathy. So our hesitant helpers, that kind of ambivalent but supportive group, and then the active ignorers who, truly just don't want to be involved. So we wanted to dive a little deeper on, sort of the views that are driving these different segments. And so here, we have kind of our representative person. This group tends to be a little bit younger, a little bit less likely to be white. And this sentiment kind of broadly represents where they stand, that, when they read a story, it makes them feel empathetic that no one deserves to live like that and that housing is a human right. So they were the most likely to empathize with their homeless neighbors. They're most supportive of housing and homelessness prevention policies. They show lower levels of fear and discomfort, and they feel empowered to help people. They're also the most opposed to policies that focus on criminalization and enforcement. So in terms of our strategic recommendations, these are the organic allies when we're trying to get projects and policies passed that benefit homeless people. They're the folks who you can sort of recruit to your side. They want to take productive steps. When they see these problems, they want to push for solutions. And so in terms of reaching this group, it's key to have that kind of call to action, right? They are ready to hear that empathetic story. They are ready to respond to it often in the way that we would want them to. But it just requires that push and requires giving them a way to plug in. And often that will help to really, drive that vocal support that can counter those very loud negative sentiments that we hear. So our hesitant helpers are, kind of these softer supporters, right? You can see here in this quote that they may have seen stories about a homeless person who is violent or hurts someone or who is a danger, but that doesn't necessarily mean that that applies to all people, and it doesn't necessarily mean that people don't deserve help. And so, compared to our involved advocates, you see a little bit more of that focus on things like addiction and mental health, a little bit less focus on homelessness as an economic issue, although that is still relevant. Like the involved advocates, they're still opposed to enforcement and broadly supportive of housing and shelter. But in contrast, they're a little bit less comfortable kind of getting actively involved. They don't feel that same level of empowerment. They're a little more hesitant about walking up and approaching someone and kind of offering that direct one-to-one interaction. They also skew more female than our other segments. So in terms of reaching these people, right, these are folks for whom we want to kind of demystify homelessness, right? And the way we phrase this is kind of turning sympathy into empathy, right? These are folks who are sympathetic, but they still have views that largely, kind of separate people into us and them, right? With homeless people representing the them. And so when we're talking to this group, our goal is to kind of create that sense of empathy, to create that connection, to help improve that level of comfort and to decrease those perceptions of danger. And so here's kind of where it's most important to address those concerns and fears, but we also have to obviously be very careful about reinforcing stigma. And so, an example of this might be trying to address the ways that mental illness and addiction are often downstream of homelessness, right? Becoming homeless, getting evicted, these can be very traumatic experiences. Living on the street, you face a lot of dangers. And so, kind of ways that can sort of flip the script can be really helpful here. Also connecting compassion to education, right? In contrast to our involved advocates who are already ready to jump off the sidelines, these are folks who you need to do a little bit more work to bring in. And then finally, this is where those sort of humanizing stories come in. When they see people on the streets, it's often the most visible people. It's people who are in moments of serious crisis, people who they don't know how to help. And so providing those more humanizing stories can really help to build that empathy, right? And, these don't necessarily have to be super shocking or over the top stories. They're stories that try and kind of create that relatability that we were talking about with our messaging recommendations, right? It's about getting people to realize that, their sort of struggles are often one and the same. Here are active ignorers. They see some stories about homelessness around, but they aren't necessarily super interested in engaging with the problem of homelessness as a policy issue or with homeless people themselves. They're very pessimistic. They're the least likely to see homelessness as a problem that we can solve. They also show lower support for policy responses than our other segments and are the most focused on issues of addiction and mental health. And so we see, sort of comparatively that perception of causes is a really important driver of attitudes. And finally, these are people who choose to ignore homeless people. So for our other groups, homelessness is often very visible when they see it on the street. These folks want to just drive by, they want to ignore it, and they want to stay out of it. The good thing for advocates is that this group is pretty generally disengaged, right? They are less likely to follow local politics closely. They're less likely to consume a lot of media. They're less likely to see stories about homelessness. And so since they're not seeking those things out, they're going to be a hard group to reach with messages from governments or nonprofits or sort of whoever that messenger is. And so what we've described here is kind of a harm reduction approach, right? These people are only going to pay attention if homelessness becomes this sort of major public controversy or a particular project becomes a major public controversy. And so one of the goals here then is just to kind of avoid pulling these people off the sidelines, avoid kind of them moving into our final category of stubborn skeptics. So these are people who tend to focus more on those negative stories, right? Trash, feces, needles, drugs, crime, right? These are the things that are associated with homelessness for stubborn skeptics. They have the most negative views of homeless people as people. They have the lowest support of housing and shelter of any group. They are the most supportive of those enforcement and criminal responses and the most fearful about crime and quality of life concerns. In contrast to other groups, they tend to be less focused on kind of systemic issues and much more focused on individualistic framings. So seeing, homelessness as a personal failing, looking at issues of drug abuse as, kind of your responsibility and something you need to sort out. So in terms of strategy, again, these are really the primary opposition, right? These are often the loudest voices in the room, disrupting a community forum and, screaming heads off. And so in terms of this group, we recommend addressing concerns but pushing back against myths, right? This is the segment that you're least likely to persuade, right? They're likely not going to show up in support, but they are bringing a set of narratives that we need as advocates to push back against, right? That, brackets out economic issues, that brackets out housing costs in favor of purely focusing on these individualistic framings. And so this also influences, kind of how we want to frame those projects, right? It's very easy to kind of frame this as like, everyone deserves housing, and so we want to give people that. And that framing can be really, really bad for this group, right? They are folks who don't like seeing that kind of, sort of sympathetic handout. And so when we're trying to address those concerns, what we recommend is really focusing on how those solutions that these folks probably oppose can actually address the concerns that they're bringing up. So for example, when talking about something like housing first, it can be really important to emphasize the treatment side of that, right? The naming convention of housing first for people who aren't involved often makes them feel like we aren't prioritizing treatment, we aren't prioritizing mental health. And so, spending a little bit more time focusing on those wraparound services, focusing on the way that housing makes it easier to get clean, to get healthy, to get the assistance you need. Those can be really good ways to sort of push back on those particular perceptions. And finally, just avoiding messages that imply some people are more deserving of help than others. This is something that's really driving the beliefs among this group, right? The idea that we can sort of split people into deserving and undeserving. And when we kind of buy into that framing, it ends up validating that idea that, some people are to blame for their own homelessness and we should not be, focusing our policies on helping them. And so, this I think is something that arises when we're talking especially about particular subpopulations, right? And so, for example, veteran homelessness, obviously a big concern, something that, I think we often feel responsible for in a way that we don't for others because of their relationship with the government. But we need to walk that careful line of not sort of buying into this framing that, like, of course we need to help veterans, but everyone else should be on their own. Or that people with a criminal record shouldn't be helped, right? Those kinds of framings end up supporting the sort of implicit views that the stubborn skeptics are bringing to the table. So based on the research, we have some kind of more general recommendations about how to message around the issue of homelessness. So first, making a human connection is key, right? People, by and large, are not that interested in systems and policies, right? Obviously, there are folks who are advocates, there are folks working in policy, there are folks who are just super invested in their local politics, but that's a really small minority of people. And a lot of those people are directly connected by their work, by their volunteering to those systems. And so it's on us as messengers, it's on us as advocates, people who care about these issues, to help others make that human connection. We have very little time in which to do that. It's often very hard for these messages to break through. And so we need to make sure that we're kind of reinforcing that idea every time that we're kind of addressing the public on these issues. Avoid reinforcing stigma and myths. this is the idea that sometimes the framings that we use can end up buying into these opposition arguments, like I was saying with, deciding if people are more deserving or undeserving, right? Or, if we dismiss folks who are facing addiction or mental health and try to focus on helping people who don't have those individual problems, we end up reinforcing that stigma against people who have those addiction issues. And so we need to make sure that in our messages, we're really pushing back against that stigma and avoiding it. Uplifting voices with lived experience. Obviously this kind of connects to that first point about making a human connection. I know from just my own experience, often the times when I feel like I'm learning the most and when I kind of get it in a way that I don't as a housed person is when I'm talking to people who are currently or formerly unhoused. Often they bring a level of expertise and experience and an ability to explain things in a way that is empathetic that we as people who haven't experienced that can't necessarily do. They also bring an ethos and credibility that advocates or social workers or whomever just don't have. Be specific. So again, this is about creating that human connection, right? Having a specific story. We want those stories to ultimately lever up to, some kind of more systemic and policy issue, but the entry point is those specific stories. When possible, make it interactive, right? We need to have these conversations, right? This sort of one-way messaging is not going to bring people around if they don't find the messenger credible, if they don't feel like their concerns are being addressed. And so this kind of speaks to that point of knowing your audience, right? You want to understand what people's concerns are. You want to allow them to bring their concerns to you so that you can address them. That speaks to that next point, though, understanding your audience, right? When we're in a closed-door meeting with a politician, that's very different than a public forum. It's very different than being invited to speak to a faith group or a community group. And so it's important to really think about your audience, about what are the concerns that they need addressed in order to feel more comfortable, to feel more empathetic, to feel more supportive of these policies. Collaborate, don't reinvent the wheel. There are a lot of groups and individuals doing messaging on homelessness, who are putting things out publicly, who are talking about these issues, who are trying to address these stigmas. And so often the resources that you might want may already be available. And in general, folks who are doing this work are quite generous with their work because they are doing it to try and create change. And so, when possible, it's often best to work with others, right? To avoid redundant work and to create a kind of consistency, to reinforce each other's messages in a way that ultimately redounds to the kinds of policies and projects that we want to see. And finally, give people easy ways to get involved. This doesn't just have to be coming and volunteering in a kitchen. It doesn't have to be, sort of showing up to a site. It might be as simple as calling some local politicians or emailing, signing a petition, right? Even these sort of small calls to action can help people to feel involved. And once they feel involved, they're invested. And so it's going to be easier to get them to take an action the next time that you're trying to advocate for something, that you want them to help you push something. And that can really have a snowball effect, right? People get involved, they learn more, and it creates potentially this positive feedback loop where learning more gets them more involved. And so, finding those on-ramps, right? Beyond just volunteering, but especially in ways that can kind of get people to start thinking about those systemic connections. And so, that's why I think things like contacting legislators is a particularly good way to do this, right? Because it sort of automatically connects the issue of homelessness back to these bigger sort of policy and political issues. A homeless woman in Minneapolis was featured. She said, just because we're homeless doesn't mean we're bad people. That is the truth. This is a person referring to a local news story that they saw, obviously in Minneapolis. And this is kind of the goal that we have with this research and, as advocates, right? It's to build that human connection, to get people to move away from those negative stereotypes and negative perceptions that homeless people are dangerous, that they are fundamentally different from all of us. And so again, it's on us as messengers to kind of constantly reinforce that empathy and to turn that empathy into more systemic thinking. So with that, I will close the research portion of our presentation and open it up for the Q&A. And hopefully the rest of my co-panelists can join us here.
Thank you, everyone. First of all, that was great. A lot of the comments we're getting in the questions are just thanking you and telling you how much they appreciate you being here. So I wanted to let you know that first. I'm going to start with some of the questions that folks gave us before the webinar when we asked for information at that point. So the first question would be, do you have any guidance on support for clients that agree to share their story, i.e. relive trauma, or tips on then proceeding in the community knowing that their story is now public?
I'll take that because it probably fits my work the most. So, in Invisible People, I have set protocols. At the very core of everything we do is nobody gets hurt. So when you're talking about a vulnerable population, you have to empower them, and it's their decision. And let's say I like to use the example of domestic violence. You'll find very few domestic violence videos on Invisible People because I will never tell a story of some woman or man who is in a DV situation that is still at risk. And this doesn't work for us. Let's say you're a domestic violence shelter. There's ways you can tell that story without identifying the person. I mean, you could do it in audio, you could animate it if you have the budget. There's different ways to tell a story. And I think how I look at it, excuse me, their program staff are very protective of their clients, and they should be. And your communication staff is always pushing to tell stories, and they should be. And there's often tension there, but that's good tension because it creates balance. Because if you go into storytelling from the lens of, gosh, the last thing I want to do is hurt anyone, you're going to establish protocols that are going to, protect people on different levels. I'm speaking a little general. You can reach out to me if you have specific examples, or join the webinar or the workshop later where we can unpack this more. But I think if you, just generally, if you go in and you are very concerned about that person, you might not even tell their story. I even record a bunch of interviews that I will never post because the person, it makes them feel good and they like the attention. So I record the video, but I'll never post it because I feel it might hurt them in some way, and I will never do that. So I think it boils down to the protocols that you have in place. You have to tell the stories, and it's important to keep everybody safe.
Yeah, I would just add to that. I think the way I think about it tends to be kind of the idea of informed consent, right? Obviously there are risks that come along with any form of publicity. So I think just having those very serious conversations, making sure that it's not just kind of a whim, but it is something that they understand the potential consequences of. They understand that people might come find them, that they might be known and are aware of those risks. Once that awareness is there, it's ultimately people's agency, right?
Yeah, sure.
In my experience, a lot of people who are currently homeless really want to help other people in the same situation, right? They want to use that. And so I think you do the best you can to really inform people of those risks. But ultimately it's up to them whether they want to take those risks and whether they feel comfortable participating. And so, you know, making sure that they know that it's not mandatory, right? If there's someone who's currently a client, that they won't face any negative consequences for saying no, and then also explaining what the potential consequences of saying yes might be.
Mike is.
The only other thing I would,
Go, Barbara.
the other piece I would just add to it when I was an agency executive director, I also would make sure that they were staffed when they did media interviews, so that if the the reporter stepped out of bounds, that you were there to stop them, so that you were very clear on what they were willing to talk about and what they weren't willing to talk about, and that you were the one that stepped in and kind of controlled it. Because just because you have an agreement with the reporter, we all know that doesn't mean they're going to follow those rules. And so I always thought it was our duty to protect the client within the boundaries that they had established before the interview was done. And that I always found clients really enjoyed that opportunity. But the other piece is also making sure that whoever's providing support in your agency to them on a clinical basis was aware that this was happening, so they were following up with them to kind of deal with it after the effect, because sometimes there are some bad consequences that happen, and they need to be supported in doing that. And like Mike said, it really is informed consent, but I would also say really specifically, do you have any open warrants? I don't really care if you do, but I just need to know that you don't, because if you do, chances are you're going to get arrested tomorrow, and I don't want that to happen. And so those kind of things, I think when you're an agency, you're going to want to add some, particularly as you're working with the media, traditional media, you'll want to be especially careful on that, because it is possible to have some adverse consequences if you're not really thinking through both the informed consent side as well as supports the individual needs. But I think it's a great way to get the message out there. No one is more effective than people speaking for themselves.
And I just got to add, I mean, both what Barb said and Mike said are brilliant, but pay them. If you're asking somebody to sign over their rights, a release, pay them. Pay them a decent, don't just slip them a 20. I mean, your marketing staff is getting paid, your communications, everybody's getting paid telling their stories. Pay the homeless person that is telling their story if you're going to ask them to sign over their rights. That's just fair.
All right, great. Thank you. We have a question that's asking, did you do some of this research in rural communities? And if not, are you planning to?
So for this round of the research, we sort of focused on places by continuum of care. And it does tend to focus more on urban homelessness here. You know, there are some people who are within those geographic areas who are a little more rural, but largely we are talking to people who are kind of urban or suburban residents. Talking to rural people does present some challenges as a researcher, right? Folks tend to be less plugged into the kinds of places where we can find them to do these surveys. And so it tends to be, unfortunately, a lot more expensive and with lower feasibility. It's something that we would definitely like to speak to, and a really good point to keep in mind, because we are planning to do an additional round of this research to really understand whether these attitudes are changing over time, you know, to what extent the pandemic may have influenced our results, maybe drove more sympathy or maybe less, we're not quite sure. But that's a really good question that unfortunately I don't think we have data that directly addresses, but it's definitely something we'll keep in mind as we think about how to construct our sample for the next round.
We went into this really under the hypothesis of something Barb said that sent us on this path, that, you know, visible homelessness is what people, you know, really is they latch on to paradigms of what they believe. So we compared communities that had more visible homelessness to communities that have less visible homelessness. So that's where we went into.
So a follow-up for that is we have some folks here from the UP. So if you are not aware, that is very rural here in Michigan. And they are asking if you have any sense of some messaging tips for small towns or more rural towns where the message might need to be tailored a little bit differently.
I think it's still personal stories. I mean, one thing I really regret about 2020 is I had a a bunch of rural storytelling lined up in Quebec, in Ontario, Canada, and upstate New York, and counties that actually have they have homeless people, but they don't have homeless services, which is a crisis. And the personal stories show the need and resonate with people. So I don't think it's really location based, although there is a law that like attracts like. So, you know, urban stories probably don't resonate as well in rural communities, and rural community stories or rural stories probably don't resonate as well in urban. So.
Yeah, and I think that goes back to sort of the importance of understanding your audience, right? On the one hand, obviously, rural homelessness and urban homelessness look very different. But at the same time, that's kind of an opportunity, right? Because, you know, we can frame some of those senses of commonality in different ways, right? So, you know, I live in LA. We're a large city with a serious housing affordability crisis, right? And so my sort of inroads to creating that sense of commonality is like, hey, you pay too much rent, you know, and so you can understand how this person fell out of the bottom of the rental market, right? If we're talking about rural communities, maybe the focus is more on the leaving of jobs, on population decline, and how that's kind of causing these economic impacts, right? And so it's about kind of identifying, I think, the struggles that your audience is dealing with as points of commonality with the struggles that homeless people in your community are dealing with. And so, you know, I think that what I would try to do there is to sort of contextualize as much as possible those problems in a way that connects them, and to, you know, use your sort of local knowledge of your community, of the problems it's facing beyond just homelessness, and to connect those back, to find those kind of opportunities to really to connect people's own anxieties to their homeless neighbors.
Okay, we have a comment that I'm going to read to you and see if you have any comment of your own to follow it up. So we have wonderful research and content. Wanted to comment on how words matter and how we frame issues matter. I still see mainstream media and organizations using the phrase the homeless. Really want us all to use person first language and the term person experiencing homelessness. I think this is consistent with your research of humanizing folks.
I think y'all looking at me. So I'm formerly homeless, and I find the term people experiencing homelessness offensive because it's not an experience. Disneyland is an experience. I understand people have good intentions, but the foundation, and I don't want to stay here very long, is you need to ask people. I mean, some well-intentioned social workers came up with people experiencing homelessness based on person first language off of the disability community. But if you even look there, person first language needs to put the person first. And if you're putting me first, I was homeless. You know, it does shape who you are. You know, you don't stay there. Hate the homelessness, not the homeless person. But from a communication standpoint, there's a lot of different phrases. Unhoused is becoming popular. I think that's amazing from a communication standpoint. But to me, unhoused doesn't talk about, it kind of gives the impression that homelessness is just housing, and it's more than just housing. And for me, I try not to say the homeless, but I'll be honest with you. When I was talking to a homeless woman, because I bought into the people experiencing homelessness, and I was talking to a homeless woman who said the homeless, and I went to correct her because, you know, you shouldn't say that. You should say people, and I went, oh my gosh, she's homeless and I'm correcting her. Majority of homeless people use the homeless. Majority of people say the word homeless. So if you're going to communicate, then you need to be, you know, using terms and phrases that people understand and that communicate. So I just want to say, I know you have the best of intentions. There is an article on invisible people, or I also recommend Googling person first language doesn't put people first. There's a lot of information about how person first language doesn't put people first.
Yeah, I would kind of echo some of that sentiment. You know, I kind of came into this space with that kind of same idea, right? That, you know, you want to talk the right way and the sort of best practices way. And what I found talking to a lot of unsheltered people is they often have very strong opinions about them being homeless people or unhoused people. There's often a big divide between people who use one or the other of those words and find the other one to be euphemistic or dehumanizing, right? And so you have different people who identify in different ways. One of the big reasons I'm skeptical of this sort of person-first language as ultimately a meaningful intervention is that increasingly we've found that politicians who are demonizing homeless people have been demonizing them as people experiencing homelessness. And sort of seeing that very well-intentioned linguistic shift employed sort of in a way that almost euphemistically covers for policies that actively harm people sort of made me question that shift a little bit. And so between that and people's self-identification, I think that it's complicated is maybe what I'd say. And I think ultimately for different, you know, people with lived experience, they have very different views on how they want to characterize that experience. And so I find that sort of a universal label is often difficult, which is why I tend to sort of pretty interchangeably use homeless person or unhoused person when I'm talking about these things.
Yeah, and remember the stigma transfers. So unhoused is becoming popular. As Mike said, people experiencing homelessness is being used, you know, negatively by politicians. That stigma transfers to whatever new phrase you're using. So I like to use, left-handed. Left-handed people were evil. You know, they're from the devil. We didn't start saying people experiencing left-handedness. We didn't say unright-handed. We changed the stigma about left-handed people. So that is where we need to use messaging and education to reduce and, you know, shatter the stigma surrounding homelessness and homeless people.
I'm going to jump in here because I do think agencies are going to want to figure out what language you want to use. And so I would suggest a process that you think about putting in place in your organization to determine how you're going to refer to people, and then also thinking through your strategies on how you're going to train your staff and volunteers to talk about the issue of homelessness and what messages you want to use. And that would be, first of all, I think every agency who's serving people who are experiencing homelessness and have an advisory council that is composed of people who have been served by your agency, are being served by your agency, and ask them for their opinions on what language is best works in your community and to describe the circumstances that they have. I worked, some of the documents that I put together, I've been able to hire writers from Invisible People to have them review documents, and they've made suggestions on language, and their preferred term was people enduring homeless rather than experiencing homelessness. And so throughout the document, that's the terminology that I use. So I think there's many ways you can deal with the language issue. I would suggest you should be intentional about it and be very careful, because any of these names can be weaponized, but your best resource are people who are working and have received benefits from your organization to participate in that. And because you are portraying their circumstances in your media outreach and your messages. And so you should be really reflecting what are the best words to use. And I work nationally, and I will say it does vary across the country as to what terms are being used and how they're being used. But you know, you can come up with a practice that really is tuned into the people your agency serves and will work best in your community.
Yeah, and just to echo that, I think when you're talking about an individual story, right, that speaks to that idea of people kind of having a self-identification, right? And so, you know, I think to the extent that you're talking about some particular person's story, you kind of want to respect the way that they choose to identify. right? Because ultimately it's their experience.
All right, so we have a question. If someone's wondering if you have any suggestions on funding a homeless speakers bureau or how they may be able to book speakers to share stories.
Certainly, this is an area, as far as having a speakers bureau, that local foundations and donors are more likely to be willing to support. And so including that as a high priority ask when you're thinking about how to outreach forward. And it does need to, as Mark said, include compensation that recognizes the expertise those individuals are bringing. And I think it also requires support to have people be prepared to be a part of that speakers bureau. And I think, Mark, you've done this in many agencies, but it can just be really, it can be a really powerful way to really get your message out there and have folks be trained advocates as part of your efforts.
I don't have anything really to add, except that it's important. You need to do it. Don't let funding stop you. I mean, if lack of funding never stopped me. It just slowed me down. This research is a good example. And when you're engaging homeless people to present, to speak, a couple of things that you have to remember is they have challenges that you might not consider, like transportation. And it also, there's a good and a bad. The good is it gives them purpose. So often you have homeless people that have been housed, formerly homeless people housed, and they're now isolated. And it's a whole new kind of pain that they're feeling, just being isolated. And it gives them purpose. But then you have to be very careful of when you put these people on a pedestal and all of a sudden now they're not speaking at the mayor's house. They're not doing all, their life all of a sudden becomes the speaker bureau. And then new homeless or formerly homeless people get introduced to it and they're not as requested. So my point is, one of the best benefits of a speakers bureau and the speaking is the purpose it gives a homeless person, but you also have to be very conscious about how it becomes their life, and you don't want to hurt them in any way when life moves on and maybe they're not being as requested as much. So it's really important to think about their well-being as being thrust into the limelight, if you will.
Yeah, and just one other thing, right, which is, I think it's really easy to start from an idea of where you want to end up and build to that. I think with things like this, it's often better to start small, right? So maybe not even a formal speaker bureau, but identifying a couple people that you already have a relationship with and that you kind of know are able to advocate for themselves and comfortable in that way. Trying to kind of develop that relationship to figure out, like, here's what we could offer as an honorarium. Is that something you're interested in? And just kind of maybe starting even from those more informal relationships. And obviously, if you get a sufficient crew of people, you can kind of formalize that. But I think often it's about, just at least at a ground level, right, connecting the right person to speak at the right audience or the right event, right? And so, I think starting from something a little bit less, say, formal and organized than a speakers bureau is something that could eventually evolve into something like that. But if it's not something that you're already doing, I think just kind of really starting kind of small, a few people, and then kind of building up from there, and thinking of yourself almost as more of a kind of intermediary to connect, interested parties, whether that's media or, events, to someone who can speak to those experiences.
And a related aside is that you have to be conscious that, if you have an event, formerly homeless people speaking, most of the people attending are going to be people that already have an affinity for homeless people. So one of the things that I did early on and I Mike talking about this, remember there was a homeless woman named Mary, and she was just wonderful. Oh my gosh. And I would pick her up, and because you got to make sure that, you know, it's an event and she doesn't have transportation and she might be drinking a little or whatever, but you go pick her up, and we would go and speak at schools and, you know, not homeless events, but other events. And then it just evolved where I would, you know, take the stage. Whenever I took the stage at social media events and tech events, I always brought a homeless person with me, and then I shut up and let them talk, because now I'm reaching that demographic, the crowd I want to reach, that need to be educated about homelessness. But to Mike's point, I just, you know, if somebody asks, whenever somebody asks me to speak, I try to get a homeless person to join me. And it just starts like that.
Yeah, one thing I want to add to that, just from my own personal experiences and mistakes, is that it can be really easy to make someone feel tokenized in these situations, right? And so you need to make sure that you are, A, giving them the space to speak to the things that matter to them, and B, making sure that you account for their needs, right? Especially if it's someone who's currently dealing with homelessness, right? Like, you know, for example, like there was someone who spoke at an event that I was part of, and they hadn't had a meal that day. None of us realized that. None of us thought to ask about it, because it's not something that we're struggling to get every day. And that left them feeling like they just were being brought in, not for their purpose, but for our purposes. And that left them feeling really crappy about the event. And, you know, from that experience, I guess my intent to take away is, like, you know, you want to ask people about their needs, about what they want out of this, and just to make sure that, you know, you're really offering them what they need in that moment, beyond just, you know, like maybe an honorarium or whatever. Maybe it's, you know, grabbing a meal as you give them a ride to the event, making sure they have transport. All of those things can really contribute to making that a comfortable experience, and to not feel like that kind of tokenizing or negative experience.
All right, I'm going to hop in here. This is Laurel again with Micah. Thank you so much for everyone sending in those questions. I know that there are more coming in still, so we could go on for quite a bit longer, but we need to close up. And so I want to just do a quick share. Oh, and share, apologies. Technology went so well for so long, and then I come on board and mess it up. All right,
Wonderful.
All right, so I just want to share a couple slides with folks about some things that we have going on here at MICA, and say thank you one last time to everyone for participating in today's webinar. There we go. Okay, so first of all, thank you to the amazing panel, to our folks with the Invisible People Research Team. You guys are amazing, and we're so grateful that you shared this information with us and that you made yourselves available for all of these questions. You're amazing, and we love you here in Michigan. So you're always welcome to come out here and have pie. We will set up the smorgasbord for you of all of the great Michigan pies. For everybody who has paid attention to or who has followed along and downloaded the PDF, I also want to acknowledge that this whole report that Mike and Mark and Barb referenced is available on the website that you're seeing on your screen. We do have a couple openings still for an interactive workshop that we have happening at 2:30 today. I know a couple people have already registered during the webinar, so thank you. If you've registered, you'll get an email soon with information about how to join us. If you would like to register, you can do so still for the next 30 minutes or so. We have just a couple spots open, and we'll be diving into more interactive activities around how we can message around homelessness based on this research. We're having an anniversary event. Micah is turning 30 this year, so I just wanted to invite everybody to participate in that as well. It's next week, next Tuesday, June 22nd, and we have an amazing speaker. Mark was our speaker several years ago for our annual event. This year we have Amanda, who's going to be coming and talking about the future of homelessness services and on our response here in the state, with a specific focus on racial equity and housing justice. So please, you're invited to join us as a virtual event on June 22nd to hear from Amanda and from others involved in the work here in the state of Michigan. We hold a monthly webinar. Allison, who facilitated our Q&A, also puts on a regular webinar series featuring topics that we think are relevant and interesting to agencies around the state. Our next one is on breastfeeding, and that is next Monday. We'll make sure that you have the information to register if that is something that you and your agency as an individual and your support systems would benefit from learning more about how we can support nursing mothers. And MICA is an organizational member, a member-based organization. So we invite both individuals and organizations to join us through an annual membership. There are benefits such as reduced prices to events that we're hosting, as well as just communications about all of the things that MICA is doing and all of the work happening around the state. And finally, I would like to send out our information for Allison and myself. If you have any questions or things that you would like to discuss, please reach out. We're always happy to hear from you. And I think I am out of time. It is 1:30 exactly. So again, one more time, thank you so much to Mark, to Mike, to Barb for this presentation, for just doing this research period. You filled a massive gap in our knowledge about how we can talk about homelessness. And I, for one, as someone who works on communications, am so appreciative that you put this together and that you found the way to fund it, Mark, and that you're sharing it with everybody in these ways that allows us to engage with the content so fully. Thank you. Again, thank you to our co-sponsors, the League for Public Policy, Michigan Community Action, and CEDAM for helping us put on this webinar. And thank you to all of you for taking the time to join us today and to learn about this. Some of you will see at 2:30, and the rest of you, I hope you have a fantastic day, and we'll see you soon. Bye, everyone.